Treatise on Febrile Diseases, a bright pearl in traditional Chinese medical classics, in the long historical process of the development of traditional Chinese medicine. The Treatise on Febrile Diseases is undoubtedly a classic work with great influence and profound significance. The Treatise on Febrile Diseases we are familiar with today was formerly known as the Treatise on Febrile and Miscellaneous Diseases. When delving into this classic, the primary task is to clarify the connotation of the term Shenghan, cold-induced diseases. In ancient times, the concept of Shenghan had broad and narrow senses, both of which played important roles in traditional Chinese medical theory and practice. In a broad sense, Shenghan is defined as a general term for all exogenous diseases. The exogenous diseases mentioned here encompass various illnesses caused by external pathogenic factors such as wind, cold, summer dampness, dryness, fire, and even pestilential qi. Although these diseases have different causes and symptoms, they share a remarkable common feature: fever. For this reason, Shenghan in a broad sense is often expressed as a general term for all exogenous febrile diseases. The word febrile here does not refer to the nature of the pathogenic factor but emphasizes that such diseases have fever as their main clinical feature. In ancient medical cognition, any disease mainly characterized by fever and caused by external pathogenic factors was included in the category of Shenghan. So, why can the character Han, cold, cover all pathogenic factors such as wind, cold, summer dampness, dryness, fire, and pestilential qi? This is because the character Han had a broad referential meaning in ancient times, that is, it generally referred to pathogenic factors. The Japanese doctor Nakanoa Tenyuki pointed out clearly in his work Research on Treatise on Febrile Diseases, regarding the pathogenic factor as Han is an ancient meaning. This clearly shows that calling pathogenic factor as Han was an existing usage in ancient times. This usage is not only reflected in the medical field but also in literary works. For example, in Mencius, Gazi, there is such a record. At that time, some people thought that the policies implemented by the emperor were not wise enough and suggested that Mencius, who often had the opportunity to meet the emperor, offer reasonable advice to urge the emperor to implement lenient policies for the benefit of the country and the people. However, Mencius helplessly stated that he had very few opportunities to meet the emperor and lamented, "After I leave, those who bring bad influences will come." Here, those who bring bad influences refer to those who spread heresies and offer bad strategies to the emperor after Mencius leaves. It can be seen that Han could generally refer to various adverse factors and heresies in ancient times, which also enables Shenghan to serve as a broad concept representing diseases caused by all pathogenic factors that the human body is exposed to. Contrary to Shenghan in a broad sense is Shenghan in a narrow sense, which is defined as the disease that occurs immediately after the human body is invaded by wind-cold pathogenic factors. When expounding Shenghan in a narrow sense, the emphasis on wind-cold pathogenic factors is particularly important because in traditional Chinese medical theory, wind pathogen is regarded as the chief of all diseases. If there is only cold pathogen without the guidance of wind pathogen, it is difficult for the cold pathogen to invade the human body alone. The wind pathogen has the characteristics of being mobile and changing rapidly. Only under the drive of the wind pathogen can the cold pathogen invade the human body and cause diseases. At the same time, to accurately define the scope of Shenghan in a narrow sense, it is also necessary to clarify its feature of immediate onset after being invaded, so as to distinguish it from latent febrile diseases, as stated in the Yellow Emperor's inner canon. If one is injured by cold in winter and the pathogenic factor lies latent in the body, one will surely suffer from warm diseases in spring. This situation, where the cold pathogen is contracted in winter and the disease breaks out in spring, does not belong to Shenghan in a narrow sense but falls within the category of Shenghan in a broad sense. Therefore, the accurate expression of Shenghan in a narrow sense is the disease that occurs immediately after the human body is invaded by wind-cold pathogenic factors. And this concept is essential basic knowledge for in-depth study of the Treatise on Febrile Diseases. In many ancient medical classics, the broad and narrow concepts of Shenghan appear frequently. For example, in the plain questions of the Yellow Emperor's inner canon, Treatise on Febrile Diseases, it is mentioned that now, febrile diseases are all the category of Shenghan, where Shenghan is obviously a broad concept, covering all exogenous diseases characterized by fever. In the classic of difficult issues, the statement there are 5 types of Shenghan: wind stroke, Shenghan, in a narrow sense, damp warm disease, febrile disease, and warm disease shows that the former Shenghan is a broad concept, encompassing various exogenous diseases, while the latter Shenghan is a narrow concept, specifically referring to the disease caused by the invasion of wind-cold pathogenic factors. In addition, the essential formulas for emergencies 引用小品方中记载伤寒雅士之词，云天行瘟疫乃田舍兼好耳，以及肘后方中贵胜雅言，总名伤寒，世俗因后为天行。这些记载表明，对于外感病，不同阶层有着不同的称呼。知识分子、医学家多称之为伤寒，而民间百姓则常用天行病、瘟疫病、天行等名称来指代，但他们所指的本质均为具有传染性和流行性的外感疾病。With the introduction of modern medicine into China, during the process of translating Western medical terms into Chinese, diseases such as typhoid fever and paratyphoid fever caused by Salmonella typhi and Salmonella paratyphi were encountered. since these diseases also have fever as their main feature. The translators selected the term Shenghan from traditional Chinese medical terms to name them. However, it should be clearly noted that Shenghan in Western medicine specifically refers to a severe infectious disease caused by specific bacteria, which is essentially different from the broad and narrow concepts of Shenghan in traditional Chinese medicine. Nevertheless, it is worth noting that traditional Chinese medicine uses the syndrome differentiation and treatment methods in the treatise on febrile diseases to treat the Shenghan disease in Western medicine and can achieve certain clinical effects at some stages, which also reflects the unique value and wide applicability of traditional Chinese medical theory and practice. The miscellaneous diseases in the treatise on febrile diseases refer to all diseases other than exogenous diseases. Regarding the meaning of the character Luan, discussion. Quoting Lucia's statement in The Literary Mind and the Carving of Dragons, Luan means to comprehensively organize various opinions and thoroughly study and refine a certain principle. Here, me means extensive, and Luan means collection, that is, the Treatise on Febrile Diseases is a work formed by extensively collecting the viewpoints and experiences of many medical experts and conducting in-depth research and discussion on relevant medical issues. Therefore, the Treatise on Febrile Diseases can be regarded as a comprehensive summary of the experiences of many medical experts in treating Shenghan diseases and also a masterpiece that integrates the achievements of traditional Chinese medicine development before the 2nd century AD. With its unique perspective and systematic exposition, it has laid a solid foundation for the development of clinical diagnosis and treatment in traditional Chinese medicine and has had an indelible and far-reaching impact on the development of traditional Chinese medicine in later generations. Exploring the rich content and unique value of Treatise on Febrile Diseases. The Treatise on Febrile Diseases, as a classic work of traditional Chinese medicine, has gathered the precious experiences of numerous physicians in treating exogenous diseases and miscellaneous diseases. It is an important crystallization of traditional Chinese medical theory and practice. To deeply understand its content and contributions, we can explore it from 2 dimensions. One is to analyze the specific composition of its 10 volumes and 22 chapters, and the other is to study it from the perspective of theory, method, formula, and error. First, let's look at the distribution and characteristics of these 22 chapters. The first chapter is the chapter on differentiating pulses, and the second is the chapter on assessing normal pulses. The chapter on differentiating pulses focuses on identifying abnormal pulses, while the chapter on assessing normal pulses mainly expounds on normal pulse conditions and also includes some content about abnormal pulses. Together, they form the essence of Zhang Zongjin's pulse theory in the development history of traditional Chinese medicine pulse theory. Zhang Zongjin's pulse theory plays a crucial role as a link between the preceding and the following. The Yellow Emperor's inner canon laid the foundation for pulse theory, and Zhang Zongjin further developed it, until Wang Shu's pulse classic, especially Li Shizen's pulse study in Binhou. The theory of pulse diagnosis was gradually perfected. Most of the content used in modern diagnosis courses is derived from pulse classic and pulse study in Binhou. However, Zhang Zongjin's chapter on differentiating pulses and chapter on assessing normal pulses, as a transition between the Yellow Emperor's inner canon and pulse study in Binhou, have many differences in the theory of what diseases the pulses indicate compared with modern knowledge. Take the slow pulse as an example. Currently, it is generally believed that the slow pulse indicates yang deficiency, which is caused by the sluggish operation of qi and blood. However, in the Treatise on Febrile Diseases, the slow pulse can not only indicate yang deficiency but also often represent deficiency of yin and blood. When there is a deficiency of yin and blood, the qi and blood cannot flow smoothly, and a slow pulse will also appear. Regarding the relationship between the pulse and the blood vessels, the classic states, those with yang qi deficiency should not be treated with diaphoresis. How do we know this? It is because of yang qi deficiency and blood deficiency. This clearly points out that the pulse is related to the blood vessels. When the pathogen is on the exterior, the qi and blood flow in the vessels, and a slow pulse may occur. Now let's look at the floating pulse. In the conventional understanding, the floating pulse indicating exterior syndrome can be felt easily upon light touch, and it becomes weaker upon heavy pressing, just like a piece of wood floating on water. But in the Treatise on Febrile Diseases, the floating pulse can not only indicate exterior syndrome but also heat syndrome. For example, in the indication of Baihu decoction, in febrile diseases with a floating and slippery pulse, there is heat on the exterior and cold in the interior, and Baihu decoction is used to treat it. Here, the floating pulse indicates heat. In the case of Ziyang syndrome, the discomfort is exactly in the epigastric region, and it hurts when pressed. For those with a floating and slippery pulse, Ziyang decoction is used to treat it. Also, there is a feeling of fullness in the epigastric region, and it is soft when pressed. For those with a floating pulse at the guan position, the Huang decoction is used to treat it. In these cases, the floating pulse all indicates heat. The floating pulse indicating heat is due to the intense interior heat, which stimulates the qi and blood, causing the blood vessels to dilate, and thus the pulse can be easily felt upon light touch. However, the floating pulse indicating heat is slippery and forceful upon heavy pressing, which is obviously different from the characteristics of the floating pulse indicating exterior syndrome. Therefore, if one wants to deeply study the theory of what diseases the pulses indicate during the transitional stage of traditional Chinese medicine pulse theory, these 2 chapters of the treatise on febrile diseases are of great research value. The 3rd chapter, Examples of Febrile Diseases, can be regarded as Zhang Zongjing's overall discussion on exogenous febrile diseases. This chapter extensively quotes the lost yin-yang great theory and the content of the Yellow Emperor's inner canon, systematically expounding the relationship between human beings and nature, including the normal and abnormal climate changes in nature, deeply exploring the causes and classifications of exogenous diseases, and proposing corresponding treatment, nursing, and preventive principles, comprehensively presenting Zhang Zongjing's profound understanding of exogenous febrile diseases. The relevant content about latent febrile diseases also provides important references for the development of warm disease theory. Scholars teaching warm disease theory will inevitably mention the contributions of the treatise on febrile diseases in this regard. The 4th chapter, Jing, convulsion, Shi, dampness, and Yi, heatstroke, diseases, includes convulsion disease, dampness disease, and heatstroke disease. Convulsion disease is manifested as opisthotonos, limb convulsions, and locked jaw. Dampness disease is caused by the human body being invaded by external dampness pathogens. Heatstroke disease is heatstroke, and all 3 belong to the category of Shanghan, cold-induced diseases, in a broad sense. Since the chapters on the 6-channel syndromes in the treatise on febrile diseases mainly focus on the syndrome differentiation and treatment of Shanghan in a narrow sense and the series of syndromes that occurred during its evolution, placing the chapter of Jing, Shi, and Yi diseases here is mainly for the purpose of differentiating and comparing it with the Shanghan in a narrow sense, stroke, and other syndromes described later. In Synopsis of the Golden Chamber, there is a special chapter elaborating on the pulse conditions, syndromes, and treatment formulas for Jing, Shi, and Yi diseases in detail. However, in the treatise on febrile diseases, only the manifestations of these diseases are described, and no specific treatment formulas are involved, indicating that the focus here is on disease differentiation. These first 4 chapters have extremely high academic research value for researchers in warm disease theory and those exploring the development history of pulse theory. From the 5th chapter to the 14th chapter, there are a total of 10 chapters, collectively known as the chapters on the 6-channel syndromes, including the upper, middle, and lower chapters of differentiating the pulse, syndrome, and treatment of Taiyang diseases, as well as differentiating Yangming diseases, differentiating Shaoyang diseases, differentiating Taiyang diseases, differentiating Shuyin diseases, differentiating Zhuyin diseases, differentiating the pulse, syndrome, and treatment of cholera diseases, and differentiating the pulse, syndrome, and treatment of complications after febrile diseases such as yin-yang exhaustion and relapse due to overstrain. Although differentiating the pulse, syndrome, and treatment of cholera diseases and differentiating the pulse, syndrome, and treatment of complications after febrile diseases such as yin-yang exhaustion and relapse due to overstrain do not belong to the typical category of six-channel diseases. Placing them after the chapters on the six-channel syndromes is, on the one hand,